back to healthcare, it's an obvious huge issue, a mammoth issue that's always there. Let's talk about for a second the presidential election in 2008.
Sure.
It's going to be a big issue. It always is. Is one side or the other, or are they going to be focusing on it more, or offering different solutions, do you think?
You know, it's the gorilla in the closet that no one wants to talk about, because it'll polarize the country one way or the other. But I think it's something that needs to be talked about. But I don't know, I haven't heard one solution that's come forward. I know that in our area, the San Francisco Mayor Gavin Newsom has proposed that in the city of San Francisco, everyone will be insured. Now that's a great, grandiose political proclamation to make, but he proposes to tax businesses who don't provide health care for their workers a percentage of their income. Now, if you were a businessman working in San Francisco, independent, a self-employed businessman, would you stay in the city or would you move to another city? I think they would move to another city. You know, it's something people believe in and want, but when it comes down to paying for it, they don't want to pay for it. They want someone else to pay for it. And coming from my background in insurance prices are lowest when you have what we call the law of large numbers. More and more people into the system, the costs are lower for everyone. But not everyone wants universal health care. And what I mean by that is we have people that are willing to pay for quality health care, not the run-of-the-mill. It's like saying that all the ocean liner accommodations will be the same for everyone. You know, that sounds great for someone who doesn't travel by ocean liner. Great, I get to go. But for someone who's used to flying or traveling first cabin, they're not going to be behind something like that. So, and universal health care, what does that really mean? What kind of deductibles or co-payments are going to be involved? What's the premium? Because those who are not insured now should pay something into the system, and those who aren't insured are not insured because they don't have the money to be insured. Their budgets are already stretched, raising kids, maybe a lot of single-parent families. So how do you require them to pay into the system when there's no money to do that? And then where's the care going to be provided? And what kind of care will there be? You know, cradle to grave coverage, or just to certain ages, or just for certain conditions?
There's all kinds of questions, and it just goes on and on.
So it's very easy to propose it, but then what does it really mean? And then how is it going to be paid for? And is the price going to be the same in California that it would be in the Midwest or in the South or someplace where the costs are a lot less? You know, that's the hard part, and the quality of care is going to be different. It's hard enough to standardize gas prices, so I just can't see that healthcare would be something that would be a quick fix. And it's easy for a politician to pronounce something, but a president, as an example, doesn't, even though he or she may promise something, I don't really believe the president runs the country. It's Congress who runs the country today, and Congress is so equally divided on most issues that nothing gets done. A lot of promises and rhetoric and, you know, grandstanding, but when the dust all settles, are we better off now than we were 4 years ago? That was an old political line from someone, you know, and then of course read my lips and all that stuff too. You just, I think you'd alienate some people by promoting universal health care, and you'd bring some people in, but by the time the program got explained and the costs, what this means to us, there's got to be a cost to it. Healthcare is already expensive, and to increase premiums more than the 20% increase that I just went through, I just can't see how that would be viable. So you're going to end up either eliminating top rung coverages to offset for the people who aren't insured. I just don't see the solution. But again, what we have right now can't continue the way it is with 20% increases. So even though I'm insured, I can't continue to pay 20% more every year. Something's got to give somewhere.
Yeah, like you said, you work harder and harder.
Exactly.
Well, it's certainly a complex issue, and if you do figure out a solution, let me know, because I'm voting for you for president.
I sure will, Eric. Thank you.
Is there anything else you'd like to add about this?
No, I just think it's nice to be able to talk about issues like this, and I know that a lot of people don't really take time to dig deeply into these things unless they're in the political realm, and a lot of people are so busy earning a living or just making ends meet that they're going to leave this to somebody else to decide. But it's there are more and more of us, and it's a bigger and bigger problem every year. It's not something that's going to go away. And like we were talking about earlier with the immigrant situation, none of those are insured, but when they come here, they're insured. And that's a big problem too for a lot of people. Legalized citizens who don't have health care aren't covered, it seems, and those who are illegals are getting health care. So
somehow.
You wonder, how can that be? But again, this may be just the perception, not reality too. So
you always have to wonder about that.
Yep.
Well, thanks so much again, Brian.
You're welcome, Eric.
Appreciate it.
Thank you.